Clinical documentation automation is the third installment of our monthly webinar series. Our goal today is to explain how you could convert some existing paper workflows into fillable electronic forms that can be used for automatic routing, data validation, tracking, and even reporting. Most of our customers are already on the road to clinical documentation automation. For some of those customers, that road is fairly long and misses some key spots for automation. There's still gaps out there for a lot of our customers. Whether that's for specialized documentation or specific departmental processes, Formfast can really help bridge those gaps in creating a stepping stone to full clinical documentation while we're providing an option as well, potentially for some future downtime operations. So this is, for some of our customers, is seen as a progression from a paper environment or process that might still be antiquated into a fully automated environment. Obviously, FastFlow will never be able to do all the functionality that an EMR would be able to do with dosage and drug-drug interaction checking. But for many Formfast customers who are printing a number of forms on demand or still have manual processes in a lot of areas, FastFlow is a natural progression on the road to a fully automated paperless solution. Each of the forms that I'll be talking about today is designed in our form design suite. It's converted from a paper format or virtually any digital format that might exist in your environment. So if you have a PDF, Excel, Word document, those can be easily imported into our design suite and converted into a fillable form. So customers who are familiar with our design suite will find it very easy to transition to designing forms in FastFlow. FastFlow, also, as well as the embedding of data that some of our customers are used to in our form imprint and web form imprint environments, FastFlow also supports use of some more robust elements in the form, like drop-down lists and predefined content, required fields, and other elements that make completing the form much more simplified for the end user. The forms can be pre-filled with data from a patient database, just like in our traditional form imprint and FastPrint applications. So in today's session, I'll discuss a few of the opportunities for improving clinical initiation and documentation processes in the organization. FastFlow is a web-based tool, so it's available on virtually any device. It can be used through Internet Explorer or Chrome, which makes it possible to use this on Android devices, iPads, any Windows device, as long as the form factor is large enough for the user to interact with the forms. It wouldn't be ideal for a phone or a smaller device, but iPads and tablet PCs are becoming more of the norm in clinical areas. So if you do have clinicians who are using iPads or Nexus tablets or Samsung tablets, whatever those are, they could access FastFlow to initiate forms if desired. FastFlow also supports some deep levels of integration with your existing systems. Whether it's registration or clinical, we can support dynamic hyperlinks which pass content into FastFlow. So we can have hyperlinks or URLs inside of host applications that allow us to open up specific forms, pass patient information, and even pre-fill that so the form is much more simplified than in a paper environment. Electronic forms can then be routed instantly anywhere in the hospital. So the recipient can receive a notification through email or potentially through some integration in their clinical system. And all of this is maintained in an audit trail. We generate notifications and keep track of the process electronically so that paperwork doesn't get lost. FastFlow also captures some of the key data elements in the forms, discrete data elements, and can restrict fields to just the contents of a drop-down, or can support free text or even integration with third-party voice recognition software. So all of this data now can be used for reporting, key performance indicators, and really improving process as a stepping stone, again, to a more robust clinical documentation process in your EMR. Some of the examples here I'll just talk about. We've got some customers who have been interested in using this in rehab, I believe sleep lab and other specialized departmental areas, nutritional services, but also some departmental workflows like obstetric forms, even pre-admission documentation like perioperative services and radiology exam requests. A number of different options for taking an existing form, putting it online, and allowing users throughout the organization, whether it's inside the hospital or through your virtual network in physician offices or outlying clinics. The documentation can then flow automatically where it needs to go. And it can be processed through FastFlow or directly input into your document imaging system in your EMR. Some of our customers have deployed this just for opening up the form, filling out some key information, and submitting it into the electronic medical record. A couple of examples that I'll talk about a little bit here. One is a radiology exam request, and another is an obstetric workflow here. The forms can mirror existing formats for comfort and ease of use. So in a lot of cases, taking an existing form and simply converting it to an electronic format provides some level of comfort for clinicians who are transitioning from that paper. It's a familiar format. The clinicians know what it looks like and know how to fill it out, and it's just a little bit different with using their mouse, but it can also be streamlined and simplified to have required elements and sections that are called out visually, and things that you can't necessarily do in paper. Even pre-selecting default values. So in the example on the left, a physician practice or ambulatory clinic might submit a diagnostic exam request. So rather than filling out a sheet of paper or printing something out of their office EMR and faxing it in, we can have some information pre-filled from their system, require some fields or have some fixed elements on the form that adhere to the organization's policies and procedures. So we don't allow certain selections on the form. We make sure that content is there that's necessary for the scheduler to perform that. And we can also dynamically route that to the appropriate person or group. So there might be a different scheduler who's working on certain diagnostic procedures. Maybe the CT or PET scans are scheduled through a different group. So all of this can be routed automatically based on which selections are chosen in the form itself. In the example on the right, an obstetrician can complete OB orders with some pre-filled defaults and patient information. So her documentation task is quicker and simpler than it would be on paper. So in this example, we have the selections already pre-filled for our best practices on this form. As an example here as well, if she makes some changes or updates the form to have some special dietary restrictions for that patient, that may trigger it to send to somebody in nutritional services who will act on that order and do some work. So again, this might be a process that is being built long-term in a clinical system or another environment in your organization, but there may be gaps where this isn't possible, or there are constraints that make it difficult to do it in a shorter time frame. So FastFlow is a lot more flexible. I often think of it as a rapid application development tool to allow you to convert easily forms that are in paper today. So in this example here, the user might open up the form, select some options in that, change the check boxes, or select some content from drop-down menus, and then submit the form. Now, that form, after selecting the patient or pre-fill content on the form, the clinician can, complete the remainder of the form, choosing any items or quickly deselecting check boxes that aren't relevant for this particular order. We also support free text fields and radio buttons, so that if there are mutually exclusive options in a list, you could only select one, or in a drop-down there might be predetermined items so that I don't inadvertently put in the wrong information in the field. But we can also make use of external software, voice recognition software such as Dragon, to complete free text fields. So I believe some of our customers are using this for just online entry of forms, click on a field, dictate into it, select some drop-downs or check boxes on the form, and submit that into the EMR. Once submitted, though, it can go into the EMR or go through an electronic route in FastFlow. That can be sent automatically to a user or a group of users for additional approval or content. So again, we might call out a certain section of this form if we want others to interact with it. We could visually separate that so that the recipient knows what content he needs to fill out. And then once the documentation is complete and the process is finished for this form, we eliminate the need for manual scanning and indexing of that form. We'll just send it directly into your document imaging system with all of the appropriate content in the correct folder. Now, FastFlow also has an internal messaging system to track workflows and send additional information to other users. In this example, there are some, for this OB nurse, there are a number of OB orders that are in her outbox. She can go in and look at where those are at any given point in time. This allows the user to have some visibility into a process without having to email or place phone calls. And this data is all residing in Formfast, but can be exposed to other applications. I know that one of our partners has been using this to display elements that need to be completed for a clinician right in their native physician portal. Recipients can receive email notifications as well. If there are rare or infrequent workflow items that they're attending to, that can prompt them and send them an email with hyperlink. That content is not going through the internet. It's just a hyperlink that's going to give them secure access to open that form inside the secure environment inside the hospital. Some other integration features allow us to display those workflow items in other systems. So our configuration has always been to be open to integration, as we are often a binding or gap filling solution between your existing environment. So we have a lot of robust integration functionality. After receiving an email notification of the pending request, the user can view, change, approve the form, and interact with it completely electronically. And as the workflow moves through a route, each person on that workflow is able to view the completed form and add content to that as necessary. In this example, the clinician is able to view the required actions on the right side of the screen under the Workflow Actions tab there, and in this case, they need to approve and sign the workflow before it goes on to the next step in the process. They can also reject that back to a previous user. FastFlow will then prompt them to enter a reason or some notes that notify the initiator why that workflow is being rejected. Maybe some key content is missing, or something is incorrect. But once they click sign and send, that digital approval is going to be inserted in the form. So my digital timestamp and signature box will be added to the form, so subsequent users can see that in this case, Betty Green has signed a form, and it's fully authenticated through their login credentials. So the logic that is defined here allows that form to route automatically to all the required parties. There's no need for the sender to know who that needs to go to. It just automatically sends to the appropriate recipients. Again, that can be dynamically determined based on content of the form. So if I'm selecting medication orders, that can automatically route to a pharmacy queue for review. If I'm selecting dietary restrictions or services, that can go to a nutrition queue for nutritional services to review. So all of that can be determined and routed as needed. We also have a visual workflow design tool. This is something that allows our customers to modify existing workflows and build additional workflows without Formfast assistance. Workflow Designer is a simple web-based tool that, that allows a lot of functionality for creating custom FastFlow routes. In our example here, we're selecting a form to be sent from an initiator to a physician of her choice within a preset group. So this can automatically send to a specific recipient, or it can prompt the user to send to someone within a group. So in this example, I might have a list of obstetric clinicians that I could choose from a list to send. But it could also route automatically. We could configure this route step to automatically send it to a risk manager if critical is selected on the form. That routing is completed. It's customizable by your organization. It's completely flexible to adapt to the needs of your environment. The steps on the left-hand column allow you to drag and drop recipients into that workflow, so you can have a very simple 2-3-step process, or have a very complex process that includes a dozen or more recipients as well, that can all be contingent steps based on content of the form. Each step can also allow us to specify whether a signature is required, or if there's a PIN. So there are two different options for capturing electronic approval. It can be a simple sign and send, or we can require the use of a personal identification number for an extra layer of security. Most of our customers deploy a Windows-based login solution where users are not manually putting their login credentials in, but it's being passed to our application by Windows. So if that is the case, some of these forms you may want to have another layer of security to add a PIN there. Our workflows also allow the use of or support of external file attachments, virtual post-it notes, and other things that make this fully functional for the recipients. As part of the process, obviously, we are capturing data on the forms. So that data is not only useful in routing of the form, but it can also be useful for reporting and dashboard features. Dashboard applications in FastFlow allow staff or managers to easily review the data they want to see about specific forms or processes. So each workflow can have its own associated dashboard, and we can customize what information is displayed here. Likewise, we can have custom reports or information that's pulled out of that and made visible or automatically delivered to the appropriate recipients. In the example here, we have a case management workflow where some key content is being captured about critical visits, maybe ICU visits that we want to track. And on my dashboard, I can see key account information, medical record number, first and last name, admit date, and anticipated discharge date. But we're also adding a column on here to automatically calculate the anticipated, or how far from that anticipated discharge date we are. We're color coding that so that it shows up as red when it passes a certain threshold. So that can all be customized as well. So we could say if they're a day or 0 days before their anticipated discharge date, maybe it turns yellow, and then past that date, it turns red. So all that is actionable information. I can provide it on dashboards, I can deliver it in emails, or create files, Excel reports for certain individuals to review. But all of that content is now useful for automating the process and gleaning valuable information from that process for future process